throughout my career, I have oddly enough actually had multiple patients referred to me for vaginal issues. And I don't recall that from fellowship. And that certainly wasn't something on my boards that came up. And I was really surprised when this started coming. And
Wasn't on your bingo card, Meagan?
No, it wasn't in my allergist bingo card. And I have done more pelvic exams than I ever thought I would as an allergist. That was very shocking to me that people are coming in with this complaint. I've had people who have issues with discharge, recurrent feelings of itchiness or discomfort. Sometimes they may have exam findings that you can see as far as like mucosal changes, but not always. And so this is something that is, I think, hard for people to talk about too. And a lot of people would never know to go to an allergist. Luckily, when I was working in the academic setting, I had a colleague who does adolescent gynecology, and she sent a patient to me, and we ended up figuring out that her symptoms in the vaginal area were actually dermatitis. And after patch testing, which is the type of testing that we can do that looks at not anaphylactic type of reactions, but those reactions that occur sort of more slowly with a different set of immune cells, we were able to figure out that this all started when she got her braces. And so on patch testing, she was actually positive to nickel and cobalt, which we later realized were both metals in her braces. And when they were removed, it all went away.
I'm sorry to interrupt you, Meagan, but just to connect the dots for people, her exposure to the metal was on her teeth and gums and mucosal surface of the mouth, but her symptoms were not showing up there. They were showing up in her genital area.
Exactly. And that's one of the things that contact dermatitis in particular that I tell people is that contact dermatitis is such a weird thing because the T cells that are really in your skin don't always have the same memory in different places. The way if you're allergic to a peanut, you eat it, sort of all the cells in your body could potentially react exactly. But for contact dermatitis, those cells don't have great memory. So it's very possible for you to have an allergy to something and have a rash, for instance, in one specific part of your body from something like a body wash that you use all over, but it just being the rash in one spot. And so I always tell people to keep that in mind because it's hard to, I think, accept that. I wash all over with this. Why isn't this rash all over? I mean, it's a very real thing. And the other thing is that different skin has different sensitivity all over your body in the sense of skin thickness. There are different portions of your body that are just more likely to show rash and symptoms of being irritated than others.